Hello everyone and welcome to MSBA's Open Session. And on this program we're going to be focusing on the issue of school-based health programs here in Missouri. And joining us to discuss that topic is the Executive Director of the Show Me School-Based Health Alliance of Missouri, Molly Ticknor. And Molly, thanks a lot for being with us. We appreciate it.
Thank you, Brent, for allowing us to be on the call.
And Molly, your organization has just completed a census of school-based health programs here in Missouri. Why did you undertake that census?
Sure. So this is the first time as a state alliance and as the state of Missouri that a full comprehensive assessment has been completed to look at what school-based health programs are, what services they offer, who they offer them to, and where they are in Missouri. So we felt very strongly that that was important in order to really assess what some of the gaps are and where some of the gaps are in healthcare services, as well as looking at how we can build partnerships together in particular areas to further support the healthcare needs of our students in Missouri.
And Molly, a lot of people may not be aware that schools are a major source of, or major resource for health services for kids in our state, aren't they?
Correct, yes. Majority, especially mental health, majority of the mental health services that our students get in the state of Missouri are provided in schools. And I just want to caveat that school-based health is different than a school nurse. So it's really a partnership between a healthcare organization in that community coming into the school and building a partnership with that district and or that school to provide holistic healthcare or particular healthcare services based on the needs of the students in the school environment where the kids are.
So Molly, what were your major findings? How prevalent are school-based health services here in Missouri?
Sure. And this is just a snapshot in time. This census started in 2019, and we're just releasing the reports and the briefs that we're going to be publishing here shortly. We have over 675 school-based health programs in Missouri, and that is their various programs ranging from school-based mental health programs, telehealth programs, which are 100% provided with a telehealth equipment, school-based health centers, which are really that holistic physical health, plus addressing the acute needs of, and they're on a school campus. Mobile health services, which are when there's a provider coming in and out, or they're provided like on a bus or a van. Dental health services are typically provided that way, as well as school-based oral programs and school-linked healthcare programs. So it's a pretty vast makeup of various types of programs around the state.
And I suppose, Molly, what is offered in a particular school district, that varies probably a lot from school district to school district, doesn't it?
Correct. And some schools and or districts can have a multiple types of programs. So they might have one provider coming in who provides specifically just mental health services and another provider coming in that provides dental. Some schools, it's one provider that comes in and is able to do all of the services, but it just depends on what resources are in that community.
Do most students in Missouri have access to at least some of these services?
I would say over our data showed us that over 500,000 students in Missouri have access. So we still have some work to do, but that's a pretty big percentage of students that we now have access to school-based health.
And are school-based health services also available to families and the broader community as well?
Yeah, so we do know that we have programs in Missouri that offer services to not only the students, but the staff and potentially the families of the staff and also the families of the students. Some of our school-based health centers are actually opened up to their communities. We do know that 78% of programs are accessible to non-student populations, given the makeup that I just said.
Mm-hmm. Are those programs, Molly, most common in elementary schools as opposed to middle schools and high schools?
Sure. So elementary is the most common type, the most common in the studies that we've done in terms of school-based health programs. However, mental health programs are most common in high school students, but it seems to be based on our census data that elementary, and we classify elementary from K through 5. That's the way that DESE classifies it, so we aligned that with that, is the most common educational environment for school-based health in Missouri.
What about the geography of all this, Molly? Are there certain areas of the state that are lacking in access to school-based health services?
Yeah, so that was a huge finding that we found, and that was one of the reasons why we really wanted to complete this census and share it with the community. There are two larger areas in the northwest region of the state and then the southeast region, kind of in the Boot Hill area, where we know that they don't have any school-based health programs. However, what we don't know and where we're going to go next is to really dive deep into those areas that don't have school-based health and determine there might be getting their services somewhere else because not every single school may be appropriate for a school-based health program. So we really need to dive deep into our data and determine what resources are in those communities and those regions and how can we better help maybe coordinate those services or determine who is doing what and if a school-based health program is appropriate for some of those communities.
Of course, Molly, we're in the midst of the coronavirus pandemic. Has that changed the way school-based health services are offered? Has it changed the sort of services that our students need?
Yes, we have seen a big shift in how school-based health providers provide their services. The silver lining with COVID is it opened up the door for our providers to do more virtual visits, so providing virtual mental health, virtual physical health screenings, and open the door to even provide those services into the home, assuming our families have access to the virtual equipment or a cell phone to be able to. So that shifted the role that school-based health plays. Unfortunately, in March, when the coronavirus started and schools closed, we did see many of our school-based health programs have to close because the schools were closed. However, over the course of the summer, being able to partner with the schools and the districts and figure out how can we meet the needs of the community. So they've shifted to potentially providing those services on a different campus off-site or being able to open up a portion of the school to really be able to continue to meet the needs of the community and the students. So it really depends on the individual communities.
So, Molly, have school districts and school buildings that have been able to offer school-based health services, have they seen a difference in terms of the health of their students and the ability of their students to stay in school and stay engaged in school?
Yeah, we actually, when we had our event last night where we released part of our census information, we showcased a few highlights of some of the school-based health programs and how they've been able to help specifically with COVID-19. We had one situation, let me just tell a quick story, where they did a flu vaccination and back to school vaccinations to help support the schools. So that not only keeps kids in school and being able to get the required vaccinations, but also doing flu vaccinations help the school and the community to be able to differentiate between COVID-19 and help overcome some of those barriers. Mental health services, we know that those needs have really increased because of COVID-19, and having an on-site clinician be able to assess and help mitigate some of the issues and the risks that are going on with those students has kept the kids in school or be able to learn even if it's virtually because they have immediate access to that mental health professional or that physical health professional. And from the parent perspective, it is really super convenient. And I think where we get our buy-in from our parents is we have parents that have had to leave their jobs to go pick up their student if they're ill or if they have a mental health issue. And sometimes parents can't take off. Sometimes parents have jobs where they cannot leave. And so being able to consent for treatment from the school-based health provider and the parent to serve the immediate needs of that student and figure out what's going on and assess that and treat them on site, whereas potentially they would have had to go home or go to a hospital to get treated. So it really definitely reduces some barriers that our parents and our students face. And it keeps the kids in school, which we know are super important to those educators because if our kids are in school and they're healthy, they're learning, and our schools are reaching their outcomes as well.
So, Molly, you have your census now, and you know where things stand as far as school-based health programs here in Missouri. So, what do we need to do next? What steps do we need to take to ensure that all students have access to these services?
Our number one goal at the Alliance is to really take this census data and pull it apart and look at some of those regional gaps that you alluded to earlier and looking at where do we need to shift our efforts? How can we bring partnerships together and really advancing the equity where we know there's disparities, where we know that potentially we have hospitals that have closed. We really need to assess that to see, are some of the areas where we know we don't have school-based health, where is the closest hospital or the closest the provider, and can we work with those local partners and those healthcare partners to connect to their schools so that we have that continuity of care.
So for
So we're
school
asking our partners to really help build those partnerships and having our schools reach out to some of the local health providers that are in their communities that the families are already being served by, and see if that partnership is appropriate for that school and that healthcare provider.
So for those districts that might be interested that haven't had these sorts of services before or minimal involvement with health services, Molly, I presume they can contact you and the Alliance, and you can give them some guidance on that.
Yes, definitely. We offer advocacy at the policy level. We also help support and provide technical assistance and training. So if we do have educators and school or district leaders who are interested in school-based health, wanting to know more and how they can get involved or how they can potentially bring the services to their area and figure out what partnerships they have available, we are most definitely available to help.
All right, Molly Ticknor, Executive Director of the Show Me School-Based Health Alliance of Missouri. Thanks a lot, Molly, for being with us. We really appreciate it. And we thank you for being with us on this edition of MSBA's Open Session.